Before the placement of the MTA, we'll just show the diagrammatic demonstration how we gonna work in the patient's mouth with our method. This is the tooth we are dealing with. This is the open apex. First we demonstrate the working length, exactly 0.5 short to the apex. After that, what we're planning to shift the place the GP and mark the GP exactly 3 mm short to the apex. See, this is the 18 mm total. This is the 15 mm GP we place inside, and we cut the 3 mm. So there is the short GP exactly 3 mm. So this short GP actually we have to fill with the MTA. So what we'll do at the time of the placement of the MTA with the carrier in the GP, with the help of the carrier in the canal, once we place the MTA in the canal with the carrier, we'll use this GP point and we'll push the GP. So what will happen exactly, GP will go till the length 15 mm and the remaining 3 mm will fill with the MTA. Once MTA is taken in the MTA carrier, we use the MTA carrier and we place in the chamber till the 10 mm length, and we drop the MTA. For example, we drop the MTA over here in this way. Here the MTA we dropped. Then what we'll do, this is the master cone which is selected previously, and we made the 3 mm short as we just explained through this first diagram. We have already gone through this diagram. Same, the short 3 mm. So at the last, what we'll do, we'll place the short GP which is 3 mm short till the working length at the chamber, and we'll push the MTA down in this way with same GP. So what will happen, the GP will stop exactly at the 15 mm length. GP will stop exactly here at the 15 mm, and this remaining 3 mm will be pushed here. So ultimately we'll get a result like this, in this way. The remaining GP which is placed till the 15 mm, this is GP till 15 mm, and our goal to reach the apex with the MTA 3 mm plug. Okay, so MTA at the apex, the GP, remaining canal is filled with the GP point. We will show how to place the MTA in root apex open cases or in the blunderbuss canal. For this, first we'll go through the which instrument is required or which instrument I prefer for the placement of the MTA. See, first this is the GP which is taken with the working length. It is the 18 mm. Then 3 other GPs with the same code which is reduced in the length with the 5 mm. This is the GP which is placed the 10 mm, actually shorter than the 5 mm of the exact working length. Then this is we prefer the MTA carrier which is having the very thin nozzle to place in the chamber. Then the regular diagnostic instrument, scissor, excavator, and the spatula and the glass slab, and the MTA itself. Pause. First we take the MTA according to requirement, then just drop off the distilled water which is provided with the MTA, then make an MTA in the increment, little bit increment, because the issue is what, the MTA placement is not a big deal, but the mixing of the MTA and the handling of the MTA in the faster manner, that matters. So I'll prefer to mix the first increment in the distilled water, then second. See, this is a still liquid consistency, but here we want a more tacky consistency. So now it's going in the tacky consistency slowly, little bit more. Here we require this basic consistency for the placement of the MTA and the pushing of the MTA 2 in the canal. After this, we'll prefer the MTA carrier with the length adjusted approximately 10 mm. See the 10 mm length with the stopper. You have to take it back. You have to load like in this way. You cannot take out the entire MTA, but the maximum amount should be go inside for the placement. Stop. Now once you taken your MTA in the carrier, place the carrier end inside the tooth. Maximally how much you can insert inside. Then just place the MTA, take out your instrument, then use the GP which is cut according to the length. This is the marking we made, approximately around 15 mm, 3 mm short. Then we are placing, mirror please. Dr. Shoeb Mujawar, please. We are placing short GP inside. So ultimately we are placing the MTA towards the apex. Stop. At the end, you after placement use the spreader and check this top at the apex. Actually short of the apex, at least 2 mm should be short. See, this is the our working length and it is short of the working length. Here I am getting this top. Can you take the video from up? See here I am getting the stop and it is short of my working length 2 mm.